Hello there everyone, this is Dr. Schroeder with this week's video introduction to week number 7 of our course in nursing research. And once again, another very good discussion in week number 6. Week number 6, we were focusing on this Lin et al. Study. This is the study of the phenomenology of deciding about hemodialysis among Taiwanese patients. And of course, this is a fairly interesting study, very typical of a got it mixed up, of a qualitative study using something called the Kalesi method. And the Kalesi method is not a very common method, actually. It is essentially a phenomenological study, and what makes it a Kalesi method is that or a Kalesi method, is that the researcher, once they've received their data or gotten their data, part of the data verification process is going back to the participants and saying, how does this look? Did we get it right? And then the subjects then have a opportunity to say, no, this isn't quite what we were saying, or this isn't quite accurate, or you forgot this, or maybe it might spark some other discussion. And in qualitative research, really everything is geared towards this concept of, besides transferability, of course, which is like generalizability in a quantitative study. In qualitative study, we're trying to get that data saturation point, at which time have we gotten enough information from everybody to say that we've pretty much covered all the themes that are available, or all the themes that are important with this particular population. And that is something that is different in qualitative. And in quantitative, we don't really have that concept. In quantitative, it's a statistical analysis. What does the chi-squared result tell us? What does the t-test tell us? What does the ANOVA tell us? The numbers tell the story. The numbers say whether a hypothesis was supported or not. Where in qualitative, it's really more, did we get everything? Did we cover everything? Did we talk to enough people to get the information that we really need? One of the first questions that comes up oftentimes is the small number of subjects. And of course, in this study, there was a total of 12 individuals, which on first glance, somebody would say, well, just 12 individuals for a whole population? Is that really enough? In a qualitative study, it most likely is, and it very likely is. You don't have to worry about power analyses or making sure that you get a certain segment of the population. The analogy that I use is this. Let's say, for example, I live in Southern California, or kind of along the western coast anyway. We get a lot of earthquakes here. You could use the same example and use hurricanes or tornadoes, but let's just say that we have a big natural disaster. And I'm in California or Mexico, and we have a big earthquake. And so I want to see what are individuals' responses to that earthquake. And maybe one of the questions that I want to ask is, who do patients, or who do individuals that have been affected by this disaster, who do they feel most comfortable calling for help? The police, or the fire department, or the hospital? Just for example. Well, if you were to want to do a study, that would be a quantitative study, because we're trying to see how this particular population, who do they feel most comfortable calling, or who would they want to reach out to? It's a statistical correlation. And so we just get a percentage of the population, maybe a total of 100 people, and do a tally and see, who did you call, or what did you do? What was your first action? Whatever the particular research question is. If it is something we're going to count numerically, then it's something that we have to have quite a few people to really get a good statistical analysis. But let's say, for example, instead of that, I'm a researcher, and I want to say, what was the earthquake like? What was the experience like for you? I can probably find 4 or 5 people that will give me data saturation. I don't have to talk to 100 people. I can probably talk to 5 people that I can talk to and really get the same amount of information. Because all that I'm really looking for is themes. What themes develop? What themes are identified? I don't come in with a preconceived notion of what those themes are. You know, people will say, well, I felt scared. I felt vulnerable. I didn't know what to do. I'd never been through anything like this before. And so the processes that you go through, and that the researcher then listens and hears people's story, and then tries to make a understand what those themes mean, what themes emerged. And then data saturation is that point at which, even if I go talk to 5 or 10 more people, I'm going to just hear the same themes. Nothing really new comes up, based on my question or based on the questions that I ask. It's a much more free-flowing and much more open process. And so this week's discussion, we're going to continue. This week we did, again, the primary discussion question was on the transferability and the applicability. And with qualitative research, it's important to realize that more than quantitative, it is important for the researcher to get involved with the patients, or excuse me, get involved with the subjects rather, oftentimes patients, but not always. And that requires them to be more selective in who they choose. So it's not getting a random sample is not really the main concern. What is the concern is getting the people that have the most real or are the most open about their experiences. So it's much more purposeful or purposive than a quantitative process. This week's discussion, we're going to continue on and we're going to talk about how did the themes develop? How did did the researchers do a good job of describing what those themes are? We're going to be looking at the same study, and just continuing on this discussion of quantitative research. And by now you can no doubt get a feel that there's a definite difference of feelings between a qualitative and a quantitative study. Qualitative reads much more like a story. Almost any qualitative study that you find is more told from a particular, almost like an emotional level, as opposed to a quantitative study that is almost always from a very statistical, cold, unfeeling. Just everything's very, very statistical. Qualitative is a much different animal that way. So I look forward to participating in class with you. Also due this week is your qualitative critique. You all have feedback on your papers from this week, so let me know if you have any questions about that. As a general rule, the critiques were done very well. There wasn't any issues that came up in the critiques. I was actually very impressed, very happy, I guess I could say, that there was nothing that anybody wrote that came up as a consistent something was missed or something wasn't gotten. Everybody did a really good job, and I anticipate that everybody will do just as well with the qualitative. As always, let me know if you have any questions. Let me know if there's anything that I can help answer. But I look forward to participating with you once again and reviewing your critiques next week, and we'll see you in the discussion forums.